Thank you and welcome to our webinar today, Wisdom Wednesdays. We're starting Wisdom Wednesdays today and it will end on September 28th. Today, I would like to introduce to you our speakers. Our topic today would be prison reform, recidivism, and reentry. And I would like to introduce you to our panelists today. First, I want to introduce you to Dr. Joan Smith. Dr. Joan Smith has had more than 15 years in the nursing profession. She's currently a nurse practitioner in pre-anesthesia, where she provides preoperative assessment in patients undergoing surgery. As a nurse practitioner, Dr. Smith is passionate about health promotion and disease prevention, especially in marginalized communities. Dr. Smith is a fierce advocate for her patients, particularly in the underserved and vulnerable populations. Dr. Smith is recognized as an equity champion by the Satcher Learning Institute of Morehouse Medical School. Dr. Smith spearheaded the partnership for the Black Nurses Association of Greater Washington, D.C. Food Project Pantry to address food insecurity in children. Thank you, Dr. Smith. The next panelist is none other than Dr. Pierre Brodnix. Dr. Brodnix has over 40 years of experience in professional nursing as a direct provider, educator, mentor, and administrator. In these roles, she has been an advocate for the vulnerable population. She is recognized as a leader in faculty as well as all levels of the quality of nursing and healthcare trends, nursing education, and the delivery of quality healthcare service to all citizens. Dr. Brodnix has also conducted research projects locally and internationally on breast cancer experiences of minority women. Dr. Brodnix has assumed leadership roles as a health policy advocate through participation in health policy councils, professional organizations, and national organizations and national initiatives. She is in great demand as a guest speaker on topics ranging from the future of nursing, nursing education, and health disparities. Dr. Brodnix was recognized as the 2013 Black Nurse of the Year by the Black Nurses Association of Greater Washington, D.C. Thank you, Dr. Brodnix. And we have with us the Honorable Pauline Maggie Drake. She became the first African-American female to be appointed as a county judge in Jacksonville, Duval County, Florida in 1998. This historical event was noted as a major accomplishment as no other African-American female had held this position either by election or by appointment. Judge Pauline Drake subsequently served a term of 21 years, having never drawn any opposition in a bid for re-election. Although she is now retired, her work with the community continues. She currently chairs the Northeast Florida Healthy Start Coalition. This organization has its primary goal is to strengthen families and to decrease infant mortality by providing needed services. She has received numerous awards from the Florida Bar Association and the Mayor's Office from the City of Jacksonville. Our last panelist is none other than Director Lamont Carey. He is a native Washingtonian. He is an accomplished author, motivational speaker, and advocate. He has been involved with various facets of reentry for the past 17 years. Mr. Carey has worked with several legislators, nonprofits, philanthropists, and other groups to focus on policy, prevention, and successful reentry. He has used his personal expertise with the criminal justice system to fuel his passion to help others recognize and overcome barriers to increase the opportunity for success. As director of DC's Mayor's Office on Returning Citizens Affairs, Mr. Carey has doubled his staff's capacity to create pathways for successful reentry and to thrive in our nation's capital. So I just want to say thank you to each of our panelists for being a part of Wisdom Wednesday. And as I said earlier, I hope that each and every last one of you would join us every Wednesday all the way until September 28th. At this time, I would like to turn it over to Dr. Joan Smith so that you can give us some statistics on what's going on with prison reform.
In 2015, the New York Times reported in New York, almost 120,000 Black men between the ages of 25 and 54 were missing from everyday life. In Chicago, 45,000 were, and more than 30,000 missing in Philadelphia. Across the South, from North Charleston, South Carolina, through Georgia, Alabama, Mississippi, and up into Ferguson, Missouri, hundreds of thousands more were missing. Incarceration and early deaths are the main drivers behind their absence. Healthy People 2030 reports between 1980 and 2014, the United States incarceration rate increased by 220%. In 2016, there were approximately 2.16 million people incarcerated in state or federal prisons and local jails. Higher rates of incarceration are often seen among certain racial and ethnic groups, particularly Black and Hispanic populations and people with lower levels of education. For example, Black people and Hispanic people are disproportionately arrested and convicted of offenses. The NAACP states that African Americans are incarcerated at more than 5 times the rate of whites. The imprisonment rate for African American women is 2 times that of white women. Nationwide, African American children represent 32% of children who are arrested, 42% of children who are detained, and 52% of children whose cases are judicially waived to criminal courts. The impact of incarceration not only affects the individual who is incarcerated, but families and communities. Children whose parents are involved in the criminal justice system suffer from psychological strain, antisocial behavior, suspension or expulsion from school, economic hardship, and are 6 times more likely to be involved in criminal activity. Partners of incarcerated individuals suffer from depression and economic hardship. Good afternoon. Good afternoon, Dr. Dawson, the president of NBNA, to my esteemed colleagues, panelists, and guests. Thank you so much for joining us for our candid conversations about prison and the boomerang effect on the Black community. Let's jump right in. Dr. Neal.
Thank you so much. Thank you for giving us the statistical data. That is amazing. It really is. So at this point, I would like to open it up with none other than Judge Drake. The information was just amazing because we are disproportionately. So Judge Drake, my very first question for you would be, it is documented that incarceration disproportionately impacts people of color. For an example, according to the NAACP, African Americans are incarcerated at more than 5 times the rate of whites. Do you feel that we are moving the needle on racial inequality in the criminal justice system? Why or why not?
I attended a criminal justice summit with the Florida Bar in 2019 in Tampa. And some of the issues that Dr. Smith talked about were addressed in that conference. And some of the things in the survey that were highlighted were as follows: lack of adequate funding, mandatory minimums, which you should understand that in the 1990s, the Florida legislator had attempted to stem crime. And some of the things that negatively impacted the African-American community were certain things as 3 strikes you're out, 10-20 life, and the 85% serving of your sentence. The process that adults and juveniles enter the system is different. For example, in the adult system, individuals are presented before a judge at a procedure called first appearance. That is where bonds are set. I participated in a program in Duval County as an experiment. They wanted a judge who would agree to do that. It was called pretrial release. What pretrial release does is allows individuals to get out of jail without posting a monetary bond and then come back to court. It was shown that in a large amount of circumstances, the bonds were extremely high. And based on economic conditions, that people weren't able to bond out. So what happens if you're sitting in jail and you can't bond out and you don't have a release because of economic circumstances? This led to a disproportionate amount of minorities pleading guilty or agreeing to accept sentences without actually going to trial or having their matters thoroughly investigated. What the pretrial program says is, even though you have been arrested for possession of drugs, if you have no prior record, you may be eligible for release with certain conditions without posting a bond. In that meeting in Tampa, they addressed pretrial, and they looked at statistics as to whether or not individuals would actually come back to court. And it was discovered that people were coming back to court. So you're not just in jail, and you're not just pleading to what we call get out of jail. Economically, socially, your exposure to the system, your ability to have immediate access to an attorney would affect how long you stayed in jail. So one of the things after the experiment with pretrial program, it was actually other judges participated in the pretrial program, and that allowed for a significant amount of individuals to be released. Other things that we discussed in Tampa at that time was something called implicit bias. Implicit bias is what things you have in your mind as a judge that may influence or affect how you see an individual. We actually had training on the circuit court level, what to look for, how to recognize it in ourselves, and how not let that affect the sentencing or what happened in that sentencing process. Another thing we looked at was mental health courts. Does this person really belong in a mental health court or drug court, which is a specialty court? And Judge Brian Davis right here in Nassau County actually started a mental health court for those individuals who actually need it other than incarceration. So these are some of the things. I started a domestic violence court to educate women, to put families back together, to divert people into other programs. Another thing that I just want to bring this up, judges look at your record. And believe it or not, if I were to tell you that most minorities entered the program through misdemeanor offenses, we often think, oh, they started out as a felony. Driving while license suspended, no driver's license. Individuals are being booked and put in jail for the non-violent offense. A program was started here in Jacksonville called Driver's License Reinstatement, where instead of putting people in jail, individuals were issued tickets so that they could come back to court, participate in the program, and get assistance in paying for the fines. I know in some places in Florida, they were actually incarcerating people for not paying fines.
Wow.
We ceased to do that. I didn't think it made any sense to issue a capias for someone for $5,000 for not coming to court and then have to pay a fine on top of that. So the economics of the situation, as well as some of these other things in the system that people think I can just handle this without an attorney, actually goes forward to that. So that's the adult system. And I don't want to run out of time. Let's talk about the juvenile system.
Yes.
In the state attorney's office across the state of Florida, there is something called a direct file. If you're 16, if you commit a crime of violence, the state attorney's office can directly file you as an adult, which means that there's a statute that has some provision for juvenile offenders. But a lot of juveniles, and I did have the statistics here, were actually being direct filed. It says in Florida, the most common method by transferring children to adult court is through direct file. In 2015 to 2016, 99% of children transferred to adult court were done by direct file. That means at the sole discretion. Who are the majority of children who are being incarcerated? Would be African Americans treated as adults. It took the Supreme Court some years ago to recognize that the minds of 16-year-olds weren't quite developed, and we were actually imposing sentences, in some cases, life in prison without the possibility of parole to children who had committed these crimes, but actually didn't have significant intervention. I could go on and on about the direct file or how juveniles get into the system. But I think that these circumstances, the bias, the bail and bond practices, mandatory minimums, as I mentioned before, but I think now we have individuals who are recognizing that. And one of the things that really, I don't know if it surprised me, but Senator Jeff Brandes, who was a senator from St. Petersburg, who was the chair of the Senate Appropriations Subcommittee and Criminal and Civil Justice, actually recognized this. He said the problem is people still have this let's be tough on crime mindset. So basically what it does, the policies, the statutes that we have in place are actually working against what we are trying to accomplish.
And isn't that so with a lot of the policies that we have in the entire United States? A lot of policies we've had in place, we're in 2022, everybody. Don't you think we need to change some of these legislative policies that we've had from so long ago so that we could move the needle and so that real justice could take place? So thank you, Judge Drake. Believe me, I will have more questions for you. So now I want to go to Director Lamont Carey. According to the Healthy People 2030, within 3 years of their release, 2 out of 3 people are rearrested, and more than 50% are incarcerated again. So what strategies or mechanisms are in place to reduce recidivism?
So in Washington, D.C., our Mayor, Mary Bowser, has been really progressive in trying to reduce recidivism and create a pathway for access to the middle class in D.C. So when individuals, my agency, which is the Mayor's Office on Return to Citizen Affairs, is mandated as the hub of reentry. But what has taken place, not only do my agency work to meet the needs of returning citizens, from everything from helping them secure birth certificates to IDs to helping them resolve ticket issues, all of these things in order to equip them to be able to go after opportunities. So we put people in like training programs, education, employment opportunities, but across the government as a whole, from public health to aging, all agencies have a responsibility in making sure every citizen in the district has a fair shot. And so this includes my population of returning citizens. And so by all of us working together with CBOs, the goal is to not only decrease recidivism, but making sure they have a fair shot and be on the pathway to the middle class. So some of the things that the district has done to reduce recidivism. So we have what is called Ban the Box, which is basically a fair opportunity for individuals who get released. So we have Ban the Box on employment. So employers are not allowed to have you ever been convicted of a crime on a job application? And if
Good.
so, then there's a penalty can be led towards that organization. And so what this does is create an opportunity for returning citizens to go in and interview, right? And to disclose how they could be an asset to this organization. Now, it doesn't completely remove, can they check and see if the individual
That's
has a
true.
criminal background, but it does give them the opportunity to sell themselves to the company. And so we also have that with housing, the same thing, to give them the fair opportunity to be qualified based off of the criteria that the housing complex or housing in general has, as well as occupational license, the same thing. And so creating these kind of legislation allows us to remove barriers for returning citizens to decrease recidivism. Because if if the government is supporting me on getting my birth certificate, helping me with tickets so I can get my license, helping me access education and job training and employment opportunity, these are some of the things that increase recidivism when they don't exist. And then to be able to remove you asking me if I'm convicted of a crime when I'm trying to find a roof over my head or apply for employment. So these are things that the district has done to put in place to help remove barriers and to give every returning citizen a fair shot. And then in closing, I would say, I am too a returning citizen. And the majority of my staff are returning citizens or family and friends of returning citizens. So not only is she looking to use legislation to remove barriers, but she also putting people that with those lived experience on the ground through the administration where we be able to have the lens from both, from being involved from the criminal side and also being involved from the policy side so that we can use our life experience and how we can connect to removing barriers through legislation. And all of that is in the effort to give all DC residents that are returning citizens the same opportunities that non-returning citizens receive. I'm not saying that there are no barriers, but we are probably one of the most progressive because the other thing that we have been able to do in the district is that returning citizens not only immediately have their right to vote once they get released from prison, but they now have for the last couple of years their right to vote while serving time, whether they're serving 1 year or whether they have several life sentences, they still can do their civic duty. And so this adds their voice to the equation where they could be better neighbors, better parents, better loved ones. And so all of these only I've named probably two of the initiatives that are in place to reduce recidivism and create a fair playing field for individuals like myself that are returning citizens.
Wow, I wish we could do that in all 50 states. What can we do to bring that to Florida or Georgia or Texas, some of these other states?
Let's have
Is there a plan in
conversations.
place to move the needle with that?
Yeah, so we've been in conversations. I believe Louisiana, definitely Boston, testified at a hearing to talk about the importance of just having an agency that focused strictly on returning citizens issues. And so, yeah, we're open to collaborating because we want every returning citizens to have a fair shot.
Yes, thank you so much. Well, I have another question for you. You would be perfect to answer this. What is your viewpoint on the use of private prisons? How do you feel about that? And then a second part to that question, what is the effect of private prisons on communities of colors and rates of incarceration? Because think about it, when I think of a private business, a private prison is a business.
So
What's your viewpoints on that?
So the district is unique as it comes to prisons in general. So our prison was closed, I believe, in 2001. So Washington, D.C. does not have a prison system. And so
Wow.
everyone that is convicted in Washington, D.C. is sent into the federal prison. And sometimes our individuals are transferred to private prisons. So our experience with them, it's all about, for me, it's about checking, crossing the T's and dotting the I's What are the policies of these institutions? What are the disciplinary actions in connection to what are the offenses that will incur a disciplinary action, right? So we know when we think of private prison or anything that is built off of profit, there can be some challenges. But as a state or as a city or as a district that may be placing some of our residents into the care of a private prison, it's our responsibility to make sure that the treatment should be above board. It should be total transparency, and we should know exactly what the conditions are, how our people will be treated, and be able to have a voice in that system. Again, because we are in a unique situation that we currently don't have a prison to oversee, so I have to engage, well, mainly more so with federal prison, because our individuals that was held at private prisons has faded out, and now all of our people, for the most part, are in federal prison. But I think the state or city that is sending their people to those institutions should also have a voice in the oversight. And there should be community members that also should be connected and be able to lend their voice. And we must have a government agency that is going in to make sure that the treatment of our people are humane, that they have access to education. So for us, incarceration should be, the major part of incarceration should be reentry, because we know the majority of prisoners will return home from prison. And so having access to education, ensuring that people are participating in education, making sure people are participating in trades will increase on the back end once they are released, their chances of having access to a full and healthy life. But it's our responsibility, again, as governments, to ensure that if our people are being sent to private prison, that we participate in the oversight of our people being there.
Thank you. Thank you. Same question for you, Judge Drake, but I have a little spin on it. So not only what is your viewpoint on the use of private prisons, but do you think the demographics in persons sentenced to private prisons, do you think they're younger or maybe more males of color or more violent or people with longer sentences? Because after all, a private prison, it is a business.
Well, I think that question came up within the state of Florida with a particular judge, I believe, who was sent, it may not have been the state of Florida, but a judge who was sentencing individuals to a private prison, and some of those children would have been eligible for release without going to prison. I agree with Director Carrot. You have to be very careful. If something is for profit, then the idea is that the more people you send there, the more profit that you'll make. In the state of Florida right now, our prison system is basically state run. There has been some consideration for private prisons. However, because of the cost, our mental health population, our aging population, and the like, I am not aware of anyone that I have sentenced or any of my colleagues that were actually sent to a private facility. Judges really don't decide which facility you go to. We leave that up strictly to the Department of Corrections to make that assignment.
Okay, thank you. Thank you so much. So the next question, I'll start with you, Judge Drake. It is actually a question for both of you. According to the Sentencing Project report, and the name of it is called Nothing But Time, elderly Americans are serving life without parole. It reports that half of the aging people serving life without parole are Black, and nearly 60% of them are definitely people of color. Older individuals who are incarcerated has multiple comorbidities, as well as physical and cognitive challenges, and they require a different type of care. So Judge Drake, what are your thoughts on legislation like the Aging People in Prison Act?
Okay, First of all, the early release is considered under certain circumstances. For example, when a person reaches end of life, and believe it or not, the end of life in prison is considered 55 years because the life expectancy is actually 10 years difference between our life expectancy. They're usually frail, sick, unlikely to become a threat to society, despite their previous criminal history, and then early release might be an option. So what are we talking about? Who are the individuals? And I think we need to address this, who are sentenced with life without parole. They've actually done some studies, because it's important to remember when I told you that 3 strikes is out and 85% of your sentence, that has an effect on the prison population. So a lot of those individuals sentenced in 1990 may be under that same standard. They become ill, frail, or the like, but these are also people who committed felonies. It's a policy change. It's a rethinking of what the community would like to do, and it's a re-education. For example, it may be someone life without parole, for example, a juvenile who committed a violent act back in the day, so to speak, and didn't get an opportunity. And believe it or not, there were individuals like that. I think that there have to be provisions, because this is what happens. If you release someone, as I said before, who's frail, sick, it places a burden on the family. I think the community needs to be prepared to have the mental health facilities, the health care for those individuals, and the family support. So I think Jeff Brandy said the same thing, but from that point of view, it has to do with cost. They still have to feed that person. They still have to take care of that person. And the cost of keeping an elderly person actually went up 200% in terms of dollars. It's a multi-million-dollar impact. I think that if any legislation is going to be proposed to do that, that the communities, where do people return? To the communities that they left. Often, those communities have barriers. So I think that any early release program, in all fairness, should not only prepare the individuals, but also be of assistance to the families and the communities. Just to say, oh, just let them go. They're frail, they're weak, they're gonna die anyway, is really saying to the communities and the families, we don't value your input, and we're just gonna pass the problem on to you. And that's how I feel about that. Not that some of these individuals should not be reviewed and released because they're no longer a threat, but also prepare communities, because what's going to happen? It may create an internal friction within that family to send the next generation to prison. How do we know that person won't be abused or mistreated? So although it's an admirable thing to do, it's something that should go forward. I think we should prepare the communities and think about those communities to which those people are going to be returned to.
Thank you. So that takes me directly to Director Lamont Carey. What types of agencies do they have in with Washington, D.C.? What type of agencies are in place for people to return to the community? How is your agency helping with the aging population? Because you say you're helping them to reentry. As these individuals are reentry and they are aging, how are you helping them?
So several things, several ways. Like the judge said, this is a very unique population. Sometime today, a gentleman is going to enter my agency that just served 50 years. Since the pandemic, we've had more individuals being released under compassionate release, and the average time spent is somewhere between 25 and 35 years in prison. So the challenge with that is some of their family don't know them,
Wow.
have passed,
Mm-hmm.
they have health challenges,
Mm-hmm.
but some of the things that we have put into place with one of our healthcare providers, we created during the pandemic a partnership where we was able to create a hotline And the sole purpose of this hotline is for individuals that's getting released from prison to get access to a primary physician and get a physical.
Mhm.
Some of our people, despite us reaching out to the institutions, requesting that when the individual get released with 90 days worth of medication. So that didn't always happen. But a bigger horror is that some of our individuals was going to pill call and they were giving them the pill, so they never held the container and didn't know what the medication was, right? And so being able to connect them to a healthcare provider that can contact the prison to try to get that medication, because some of this stuff was like for heart, right? And other ailments that you just can't physically touch them and see what's wrong with them. And so being able to help partner with a healthcare provider that can help us get access to the records so that they can be treated as one. The second thing has always been housing, right? A lot of these individuals come home again, family members either move past or don't really know them or have moved out of state, but they was released to the district. And now we get a limited amount of housing vouchers that we have to try to provide for, on average, up to 2,500 individuals that we see a year. Now, housing vouchers doesn't match that, but our mayor does have a goal of 24,000 units, 25,000 units by the year 2026 for individuals. So housing is a huge barrier. So some of those individuals we can get into housing, or through our partnerships with transitional housings, we can get them into those. But we also have with Department of Aging and other resources that we can attach them to. So the one thing that my agency has shifted from is that we don't see returning citizens just as returning citizens. We see them as people. And that opens up to all other kinds of opportunities with the Department of Aging, with Department of Disability, with DHS, Department of Human Services, so we can get them food stamps, we can get them Medicaid and things of that nature upon release. But I agree with the judge in that we have to work to make the communities, the families more aware. So we're encouraging organizations to start what is called family reunification support groups, so the families can understand the internal and external barriers of their loved ones. And also so that we can help break some of those broken relationships, because it's not our family members that are coming home that are classified as homeless. It's not because they don't have families, but because the relationships are shattered. So if we can reduce some of those burdens, we can get more of our people, these older individuals, into housing where they have a built-in support system with loved ones. And the third thing that we have been working on is attaching resources, how to attach resources to the family, because 99% of the individuals coming home from prison that are seniors or younger don't own their own home. So they're moving into a household with somebody that's in an underserved community for the most part. So it's an underserved, limited resource household. And so last year we passed where the mayor put in funding where we can provide some funding to the family member to help stabilize the housing for longer. And also to pay like first month and security deposit to try to help out people to get into some housing. And some bills that were passed is the Individual Reduction Amendment Act. And this was for individuals that was charged as under the age of 18 to long prison sentences, where they can petition the court and come back before the judge and potentially be resentenced. And then after that worked so well, then we entered the second look for individuals that went to prison under the age of 25. And this goes back into what Your Honor was saying about the brain development. And so we're moving as many barriers that we possibly can to help seniors and individuals in general, but all of this consists of a community effort. Instead of looking at how we help individuals on the back end, we are strongly pushing that we prevent individuals from even going into prison. And so the last thing I'll say, our juvenile department that usually handles corrections has now opened it up where the district is for individuals that have never had interactions with the criminal justice system can have access to programming, because before you had to have been involved with the criminal justice system to access certain programs. So we have removed those barriers in order to prevent individuals from ever becoming a client of MORCA. But the senior population, even though they're older in age, some of them are fit, all of them are not sickly, some of them are extremely healthy, they want to work, they want to move around. And so we just try to create as many opportunities for them as we can. But it is a cost on the prison system
Yes.
to be helping those that are sickly. And if they are no longer a threat to society, then we really should consider releasing them. And that's another thing we have had implemented, compassionate release. And so individuals have, a lot of seniors have been getting released through those 3 channels of legislation that I just mentioned. But we are always looking to better that transitional process for them. But we're doing everything in our power to make that process, that transition smoother for them. But the biggest goal for the district is to prevent individuals from becoming incarcerated in the first place.
And, you know, 3 things came to my mind as you were speaking. Number one, I'm thinking of someone on dialysis. All of a sudden you're in prison and you start having problems with your kidneys. How are they doing dialysis in the prison? Are they sending them to a dialysis center? How are they handling that? That's number one. Before you answer that, number two, you talk about you had 2,500 people released, but you didn't have enough space. So what's happening to these people? Are they becoming homeless? And number three, this is awesome, everything you're doing in DC, but are we doing this in all of the other 50 states? I hope we are. So could you please address the dialysis one? Because that really gets to me, because sometimes, you know, it could happen at a very young age. How are they dealing with that type? Are they automatically releasing them from prison, or they still have to serve their sentence and they're sending them to a dialysis center? Do you know?
Yeah, from my understanding is that they had to go through dialysis. For most institutions, they are receiving it there, or some, I believe, are, depending on your security level, how much you exit an institution for treatment. So again, it depends on the institution. But again, most of our people are going into the federal institution, and they are not releasing you because you have kidney
failure.
issues, right? The hope is that they can get released. Individuals can get released through compassionate release. And that is what has been happening. And your second question was in regards to the homelessness. So out of the 2,500 that may get released a year, there are majority of individuals are moving into the household with someone else. So they're really seen as homeless in some ways, right? There's a smaller number of individuals that are going into the shelter system. And a lot of times those that don't have access to housing will be sex offenders, right? Those are the hardest ones to place in anything, because that level of scrutiny that they receive from everything is in policies and housing projects, that if you have ever been convicted of a sex act, that you can't go. Right? People are also accessing like those websites and posting pictures up. And so housing for them is one of the biggest barriers. But we do have individuals that do go to shelters, but our goal here at MORCA is to try to find alternatives to shelters for individuals by transitional housing and other kind of housing, substance abuse housing, or whatever we can find that is fitting for them, and so they won't have to end up in the street. And that's the last goal for us, for them to be homeless.
Thank you, thank you. So my next question, I want to talk a little bit about the impact of COVID-19. A lot of people died because of COVID-19. how was that impacted in the prison system? Because if we have overcrowding in the prison system, how did they separate them? I mean, did they have to wear their masks? I mean, did more people die? And if they did, what race played a factor in the death of people in prisons doing COVID-19? And this question is for both Judge Drake and for yourself, Director Lamont. Who would like to take this question?
Well, I can start.
Okay.
Some of that information on deaths with the Federal Bureau of Prison, that is a challenge, getting information at times about anything that is related to an individual, right? But what we do know, in order to create space for individuals, a lot of individuals that were classified or have a release coming up soon were released into halfway houses. They was released onto home confinement to make space so that can decrease the spread of COVID. And everyone was I know in the federal system, they were giving them masks, because we even offered to provide masks as well for DC residents. So those are some of the steps that I know of that was taking place in the institutions.
Thank you, Judge Drake.
And in the Duval County Jail, there were individuals, as I said before, they would look to see if there was overcrowding, whether or not any of those, there were some individuals who could be released, even though they had previous bonds and the like, to make room so that they could isolate. I know that they did testing frequently within the Duval County Jail, and that once you were positive, this is how it worked. For example, if you had a defendant who had tested positive, they weren't allowed to come out and have contact with the attorneys. This was an issue, of course, when they decided to go back, because the issue is too, in the state of Florida, we have something that's called speedy trial. Misdemeanor brought to trial within 90 days, felony 120 days. Okay, so what you do is you look at that population and you say, okay, if we keep passing the case and like the court system was shut down, everything was video or the like, what happens? Your population is increasing and no one is going home. So what they've decided to do is they use the video, and if a person was eligible for pretrial or to go into a diversionary program like the mental health court or drug court, there was a more consistent effort to do that. The jail has to really monitor the illness. I know sometimes when I was on the bench, I would say, look, if this person is contagious or whatever, make sure they get medical treatment. Do not bring that individual out. But here again, as to any statistics individually as to how many people actually died, you would not have access to that kind of information.
So that's private.
And if I can add, in the Federal Bureau of Prison, I think the last time we communicated with them, I think 95% of prisoners, not just DC prisoners, but prisoners in general, have been vaccinated, and a large have even seen the boosters.
Oh, that's
Right.
good.
Yeah.
So even in Duval County, they were giving vaccinations to prisoners and and the like. And sometimes, when I would go into J1, they would have such, in terms of medical care and the like, that the population on the outside was actually less sicker than the population on the inside.
What if,
Opposite, so to speak.
I get it. So what if you have a prisoner that says, oh, I'm sorry, I don't want the vaccine? What do they do? Do they not have a choice because you're in prison?
No. That right is not taken from you.
Okay.
You can actually say no. The same way if a person has a mental health condition, we can't force feed anybody medication. So if the individual says, I'm not taking that drug or the like, we cannot force them to do that. Now, if that person's, for example, psychological condition becomes such that he's a danger to himself or others, he can be removed from that, actually, the prison, to a hospital facility that can better monitor that, so to speak. But no, it was not, like in the state of Florida, people fought the mandatory vaccinations, even with healthcare workers and the like. So no, it was not forced on the individuals in the jail.
And I can say for the DC residents that we have been in contact with, for the prisoners that we visit, they was terrified. And so all of them that we spoke to, for the most part, I think I've only met one individual that opted out of it, but most of them were eager and didn't understand how an individual did want to be vaccinated. And because they were in close quarters, I'm sure the level of stress and anxiety definitely increased, and was part of the encouragement for them to become vaccinated and boosted.
Thank you. So I have one last question because I want to leave a little bit of space. We're at 12:51 now. I want to leave some time for Dr. Broadnax to summarize everything. And I also want to open up the floor for question and answer for our guests, participants. And this question is for both of you guys. Do you feel, because of the increasing number of minority men in prison, that the family unit is broken, and having a male incarcerated ends up having a trickle-down effect on the next generation? And I'll start with you, Judge Drake. And you know what? That could also be the female, the mother could also be in prison. So could you answer that, Judge Drake? And then I'm gonna go to you, Director Curie.
From the man's point of view, definitely yes. I've seen people in my courtroom whose father, whose uncle, whose brother, you know, everybody had been in prison or been in the system. We underestimate the trauma on a Black male who doesn't have a positive image. And I learned so much from the organization with the Northeast Florida Healthy Start Coalition when our initiative with Fatherhood Pride, where when I spoke to Jack Johnson, he said, it's not that Black men don't want to become fathers. It's not that they don't want to do the right thing. Having not grown up in a hospital, in a household, they need to be trained. They need to understand what it is to be a man, what it is for that support. And what the prison system does, it disconnects. It says you're a bad person, it pushes you to the side, says you should not have any contact with your children, they should not know where you are. And sometimes that creates more anxiety than actually establishing a connection with families. And I think that's so important because we cannot underestimate the psychological effect that has on a young man or a young woman in selecting. Will she select someone that's abusive? Will she decide that she's not deserving to be loved or the like? Now, the Azalea Project, and this is one of the things I'm proud of, I suppose, most, I guess I want to refer to it as the prostitution court. And you know, when all of the strippers or the people would be arrested and we would have the young ones and the old ones, one of the things I would say is, okay, now we need to be honest. We need to come down here and we need to tell them that stripping on that pole is not going to be the best thing. And unfortunately, I had a young mother whose friend came back and said, Judge, I know you warned her. We tried to do a lot of things. She leaves behind 4 children. She was actually murdered or killed by one of her customers. And that has a negative effect because what happens is we have far too many African-American children going into a foster care system. We are disproportionately represented in the foster care system. And when you're turned loose at 18 and your funding stops and your education and your introduction to society and how you get ahead, that just further leads to dysfunction. So I think it's important to have programs within the Northeast Florida Healthy Start Coalition that does Azalea, that does Magnolia, that stresses the family, that has fatherhood and other programs, for example, that are available out there. Ready for Work is a program, the Operation New Hope, all of those programs that we need to be connected with, because when we destroy that central family union, and I just need to say this, historically, as Black folks, we deal with that dysfunction as a vestige of slavery. We were separated as children, as men, and as women. And we've had to play catch up in building upon relationships that say we deserve to be loved, we can be caring, we deserve to be treated in a humane factor. And I think that is so important in keeping us out of the system. Intact families can assist with that. You know, I remember Jack and I were talking about, I'm gonna stop. I went to an elementary school because this is what I do, I adopt inner city schools, and the kids were walking around like this down the hall with their hands folded. They couldn't touch, they couldn't contact or anything. And then when that father saw that, he said, oh, that's how we walk in prison. We're not allowed to make contact. We're to stay to ourselves. So I'm a really big proponent on what we can do to strengthen men and women in the community, because without that, it's going to be a revolving door. We have to expose them to opportunities. You know, if you never see anything but the broken glass, the prostitute on the corner, the club, or somebody selling, that's your focus. We have to have programs that expose kids in the elementary schools, in the middle schools, that there's something better out there.
Thank you. Thank you so much. Director Carey, same question.
So before we even talk about prison separating fathers from their family, I think we have to look at some of our governments with our public housing where the man can't live in the household.
Mm-hmm.
And then when we say that Black men don't want to be involved in their children's life, I think we should pull up in the morning when the school opening, and you'll see how many fathers dropping their kid off and picking their kid up. So our men are more engaged than society say that they are. And so I think it's a discredit to our men. And when it comes to individuals in prison, they try. I mean, I was in prison with thousands of them. They try to keep that link with their children from getting Christmas cards, birthday cards made, trying to communicate with teachers and all of it. They try to stay engaged. But one way we can help them to re-engage is the parenting programs in prison, because a lot of times they think they're being a disciplinary, right? But I can tell you 90% of the individual men that come into my agency want a mentor. They want to involved to stop young people from going down the same path that they left. So that speaks to their dedication. But in the way that we can help them is getting these barriers removed, right? Encouraging employers to hire returning citizens so they can contribute and won't be getting rearrested because they hold child support, right?
Right.
Removing barriers where kids can be chaperoned so they can go with their kids on a field trip, right? So removing barriers better equip them, and helping them. As a father that was a returning citizen, disclose a little bit, one of my fears were when me and my son's mother broke up, that if I took her to the courts, I was going to automatically lose in every way possible. So it's up to us to remove that fear so that fathers can be more confident in trying to be active and being engaged and being the guardian at times of their child. So
Right.
It takes the community really to help us to create a safe space for men and women coming home to our communities, and we should receive full rights, right? If I can't go on a school trip with my child, that's limiting me from being a full father. So just things that seem little are huge when you're a father that's trying to engage. But we need the community's help. So that we can get housing, so that we can get job, so that we can get access to Medicaid or some kind of health insurance, so that we can be healthy and so that we can model a new behavior for our children.
Thank you. And we need to have different community projects. And all 50 states great projects to help with reentry, to help with the Fatherhood Pride program, Azalea project, all of these different projects, we need to have it. The project you have, Director Carey, I wish we could have that everywhere to help people with a rehabilitation when they come out. So at this point, I want to turn it over to Dr. Pierre Broadnax to summarize everything we discussed today. Dr. Broadnax?
Well, thank you so much. I trying to turn on my video. I thoroughly enjoyed the presentation and found it very informative. I'm gonna go through this quickly. Dr. Smith, thank you so much for those eye-opening statistics. And what sticks out to me more than anything else are the numbers of missing individuals in the community. So if you have hundreds of thousands of individuals, you predominantly males, missing from your community, what happens to the backbone of your community and to the family? And you mentioned how many children are also being incarcerated. And even though we know that there are children committing crimes, the numbers were really eye-opening. We started off with Dr. Drake, and she shared the programs that they started in Florida to help divert the numbers of people who were incarcerated. She spoke about the lack of funding and mandatory minimums as those major factors contributing to the increase in numbers of persons being incarcerated. And especially since the 1990s when mandatory minimums were first instituted. And the what I thought was very meaningful was the training of implicit bias that the judges had to go through to understand what biases they had against the persons who were coming before them. And starting the mental health court, domestic violence court, which were very, very meaningful to those citizens. And then we talked about the numbers of juveniles and how many are considered adults starting at the age of 16. And so there are policies that are in place now that are working against what we're trying to do to unite our communities and bring incarcerated persons back into the fold of the family. We talked about, Director Carrick talked about Ban the Box, which is being implemented in the District of Columbia. And in this, the employers are not allowed to ask about a person's criminal background, as well as those who are renting housing. They can no longer inquire about the background. So we need to remove those barriers. And we moved on to the private prisons. And we're fortunate that the District of Columbia no longer utilizes private prisons in the district proper, but our residents are being sent to other places in the country that will that still use private prisons. So we want to make sure that we monitor closely the quality of services that they are receiving, that they are treated well, that they have opportunities for work and education. And then we talked about the elderly persons who are still incarcerated, life behind bars. And what I found was fascinating is that at 55, you're considered end of life. And so they are starting to, well, not starting to, but they release persons who are 55, but the community and the families need support in receiving those individuals. We talked about how even when they are released, the families may be underserved and under-resourced and not able to receive them. So we moved on to how we need housing. And the major thing that Director Carey brought out is that the importance of developing partnerships. And in the District of Columbia, we are partnering with the Department of Housing, Department of Aging, Disability, and human services. So the goal is really to help unify the family. And one question that really brought interest was, how are patients who are experiencing renal failure, how do they receive services? So the services are really, the persons are sent to dialysis centers in the city, really depending upon their security levels. So the District of Columbia seems to be more forward moving than others, not to say that other states are not moving forward or implementing various reforms. But we had Director Carey here. And the impact of COVID. Yes, some inmates were sent to, incarcerated persons were sent to the diversionary programs rather than actually being sent to prison. So the individuals who came up who were charged with crimes, rather than being incarcerated or sent to jail, they were sent to other programs. And 95% of the persons in the Federal Bureau of Prisons were vaccinated. And prisoners have rights, and they have a right to refuse to be vaccinated, just like anyone else. And we talked about the broken families and how how the families are impacted with males and females are taken out of the family and how it impacts the children. So I think I tried to cover as much as possible. And if you have any questions, I just want to thank everyone for coming on, and hope you stay tuned for the next in-house series.
Thank you.
Dr. Neal?
Thank you, Dr. Broadnax. So basically, our next is on September 7th, health harms of incarceration. And Dr. Smith, do we have any questions in the chat box? Are there any questions?
Thank you so much, Dr. Neal. Actually, there was one comment. Thank you for the dialysis question. They thought that was a good question. And I believe the questions about vaccinations for COVID prisoners has already been addressed. And we do have a question. Please highlight the difference for women in prison. And so, believe it or not, we actually have a series dedicated just to that topic. So I'm going to encourage you to tune in on September the 14th. And the topic is what happens to our daughters, our mothers, and our sisters. And we will be focusing on women in prison. And Director Carey put his contact information in the chat as well. So I don't see any additional questions at this time.
Thank you. So at this point, I would like to say thank you to Judge Pauline Drake, and thank you to Director Lamont Carey. Let's give them a hand clap. Thank you so much for joining us today and making this a successful webinar. And as we stated, this is a webinar series on prison reform. We're having candid conversations about prison and the boomerang effect on the Black community. And we just would like to say thank you for joining us during this time. And at this point, we're going to end this webinar. Goodbye. Have a great day, everybody. Bye-bye.